Today I want to talk about older adults and depression. So there's a common misconception that when people age, they become depressed. But this is actually a myth. And today I want to set the record straight. So in this episode, I'm going to share the rates of depression in older adults, signs of depression, and what to do if you're worried that your aging parent may be depressed. Hello there, I am Dr. Regina Koepp, and this is the Caring for Aging Parents show. I'm a board-certified clinical psychologist, and I specialize in older adults and families. I help you manage the most complicated situations with your aging parents so that you have peace of mind knowing that you are doing everything you can to help your parents live their best lives without giving up your own life in the process. So for the best tips on helping you to care for your aging parents, subscribe to my show and you'll get new tips every Wednesday. Okay, so what are the rates of depression for older adults? According to the Centers for Disease Control and Prevention, that's the CDC, only 1 to 5% of people 65 and older living in the community have depression. So the rates do increase when older adults are in the hospital for a medical problem, but they increase only to 11.5% and still a little bit more to 13.5% when older adults require home health assistance in their home. So according to the National Institute of Health, adults 50 years and older actually have the lowest rates of depression among all adults. The group with the highest rates of depression are young adults between 18 to 25 years old. So you can see the vast majority of older adults don't have depression. Even with this said, while most older adults don't develop depression, depression is actually the most prevalent mental health condition among older adults. So if you're caring for an aging parent, especially aging parents who have medical problems or receive home health assistance, or if they are in the hospital or have recently been in the hospital, it's important that you're aware of some of the signs and symptoms so that you have the tools that you need to help your aging parents if they need it. So here's a list of the signs of depression in older adults. Persistent sadness or crying a lot, feeling worthless or helpless, feeling slowed down, excessive worries about finances and health problems, changes in appetite resulting in weight gain or weight loss, pacing and fidgeting, or the opposite, being unusually still. Changes in sleep like sleeping too much or too little, difficulty concentrating, physical symptoms like pain or gastrointestinal problems like upset tummy, and withdrawal from regular social activities. So that's a list of signs and symptoms. But in order to meet the criteria for a depressive disorder, the older adult only has to have 5 of those symptoms lasting for 2 or more weeks. And those symptoms must affect how they're functioning. Like, is it affecting how they're functioning in their friendships or relationships, how they're taking care of themselves, or how they're engaging in activities? Okay, so now what should you do if you're concerned that your aging parent has depression? The first thing to do is talk with them about what you've been noticing. And when you do talk with them, be compassionate as well as concerned. Offer to help them get evaluated and treated. So here are the steps to evaluation that I'd recommend. Encourage you and your parent, or perhaps your parent on their own, to see their primary care provider first, so that they can rule out any medical issues that might be causing these symptoms. If medical concerns are ruled out or properly treated, then number 3 is to help your parent get connected with a mental health provider who specializes with older adults. I have a list of how to find these mental health providers in my show notes, so head on over to my website to learn more. So I started this episode by saying that depression is not a normal part of aging, and I want to tell you why this is so important. As a result of the false belief that with age comes depression, older adults are living with depressive disorders when they don't have to. And this is because many people wrongly think that the person is old or ill, so they must be depressed. But this belief is not only wrong, it keeps people suffering when they don't have to. In fact, the CDC tells us that 80% of the cases of depression in older adults are treatable. But here's the thing, they can't get treated if their depression goes unrecognized. So not only does treating depression in older adults alleviate suffering, we know that when depression goes untreated in older adults, they have more medical problems. They stay longer in the hospital, they use more medication for their medical problems, and have more visits to the ER. And then the topper is that they experience more loneliness and isolation than other older adults who have their depression treated. So this is where you come in. First, you can begin to shift your view that with age comes depression, because it doesn't. And secondly, you can help your aging parent get connected to providers and resources that can help treat suffering and ease their pain. So please don't ignore these signs and symptoms. Instead, lean in, share your concerns, and help them get connected to their providers. That's all for today, and in wrapping up, I wanted to share with you an important guide that I made called Dementia 101, a beginner's guide to dementia disorders. In this guide, I talk about what dementia is and what it isn't. I describe the phases of dementia and what to do if you're worried that your aging parent may have dementia. I'll link to it in my show notes, so take a minute and download it. It answers some of the most frequently asked questions I get about dementia. If this video was helpful, be sure to subscribe, and don't forget to share this video with your friends who are caring for their aging parents, because nobody should have to do this caregiving thing alone.